Good morning, and also again, thank you for the opportunity to share WPRO's experience. So, as you all know, the Western Pacific region has the largest hepatitis B burden among all WHO regions. And according to 2019 data, about 45% of people with chronic hepatitis B are living in the Western Pacific region. And the regional committee actually started to promote accelerated control of hepatitis B since early 2000. So there was a regional committee meeting in 2005 to establish the target of a 1% surface antigen prevalence among children 5 years of age by 2017. So this slide gives you an overview of the current situation by the surface antigen status. And so there, the status is color-coded. So right now, about 21 countries in the region has achieved this target of 1%. And we have another 5 countries, the data show they have achieved this target but has not been verified yet. And we still have 11 countries, they have not yet achieved this target. And from this bar, the pie chart, you can see among these 26 countries, they have already achieved this regional target of 1%. 10 of them actually already achieved this 0.1 2030 global target. Another 10 countries actually is between 0.5 to 0.1%. And then we still have 6 countries, they are between 0.5 to 1% in that range. So this slide shows the birth dose coverage situation from the 2022 data. And this slide basically gives you some ideas of the current situation of the birth dose in our region. And from here, as you can see, so even during the pandemic, we still have quite most of our countries actually did quite well. They actually reached our regional milestone. As you can see here, our regional milestone actually set a higher bar than the global GHSS target. So our regional milestone is 95%. And but this slide also tells you we have also quite a few countries they actually didn't reach that milestone. But particularly concerning that is some of the countries, they actually had a good prevalence, but they actually had a significant drop of the birth dose coverage. This slide gives you an overview of the third dose coverage in our region. And this actually shows actually we had quite a significant decrease in the third dose coverage among WPRO countries. And we think this is probably due to the impact of the pandemic, because in our region, now we have 80% of the country, they are actually using Penta or Hexa in the immunization. So, so then the Hep B is not just a Hep B vaccine issue, it's actually the overall childhood immunization issue. So this is why the third dose is getting more impacted during the pandemic. So in summary, the countries and areas in the Western Pacific region made a remarkable progress in the accelerated control of Hep B through immunization. However, significant challenges remains and need to be addressed. So the impact of COVID pandemic on routine immunization in the national immunization programs, I think that really need to be addressed. And also issues affecting the birth dose coverage in remote areas in some of the low and low-mid-income countries. And so the cold chain requirement is a major hurdle in some of those areas. So the out of cold chain use and the controlled temperature chain, I think this is really a something we need to work together to address, as Rania showed in her presentation. So there are a lot of evidence actually support this already, but I think there hasn't been a whole lot of progress in this. And when more countries now are introducing Hep B birth dose, I think this will have more impact to more countries. And then the birth outside of a health facility is also a major hurdle in some of those remote areas. I think this is a even bigger issue that need a community health care and health worker outreach. So basically need a health system strengthening in the overall healthcare system. I'll stop here. Thank you very much.
Thank you so much. Let's bring forward Dr. Leandro Sereno, who's the medical officer at Hepatitis Focal Point for the Pan American Health Organization, and which is the WHO Regional Office for the Americas. He's been a close colleague for a number of years. Leandro, welcome.
Thank you, John, and thank you for the organizers for this opportunity and invitation for PAHO to be part of this panel. Good morning. And I don't have slides, I don't have a presentation, but I'll quickly summarize some of the work that PAHO is promoting in the region of the Americas to scale up the elimination of mother-to-child transmission of hepatitis B. And the first comment I'd like to say is highlight the importance of integration. We know that the resources are limited, especially for viral hepatitis, so we need to take advantage of the resources and the capacity already deployed. And at PAHO, member states have approved and endorsed the EMTCT Plus initiative, which is the framework for the elimination of mother-to-child transmission of HIV, syphilis, hepatitis B, and Chagas disease. So the idea is to take advantage of this capacity. We know that the rationale is to leverage on the capacity for HIV and the programs for EMTCT of HIV that have been achieving great advance in the region, and also to leverage on the robust immunization programs, especially for hepatitis. The region in the Americas, countries have been vaccinated against hepatitis for the past 30 years. So we, because of that, the region has a relatively lower prevalence for hepatitis B. And we may have achieved overall at the regional level the impact targets for the elimination of the prevalence of 0.1% among 5 years old. And as we approach the elimination, we need to replicate this at the national level, but as we approach the elimination, I think the last mile is the most difficult and the more investment that we need, and that's become an issue of equity in health. because the most populations not being addressed and reached by the health system are the most vulnerable, and we need to include this. So integrating services, integrating a package of services, and considering and leverage on the capacity already deployed will allow us to kind of reach this vulnerable population. And the second one would be the interprogrammatic approach. We're discussing about integration of services at the services level, but we need also an interprogrammatic coordination at the higher levels within the Ministry of Health, including also the decentralization and using the primary health care as an opportunity to deliver service. And we heard about this from many experiences during the meeting. This interprogrammatic approach, decentralization, the discussion among the different departments within the Ministry of Health will allow us to harness on the political commitment that exists from other diseases like HIV, the elimination of EMTCT of HIV. There is a lot of political commitment on this, political will. So we need to use that political will that already exists and also to make that reflect an impact on hepatitis as well. We need to use that political will and make it and transform into action, so we can move forward with the EMTCT. And as as I was saying, the lower prevalence, the most vulnerable population, we heard about the impact of the vaccination, but we also need to consider that for this small gap that we need to reach, additional interventions may be needed. So screening for hepatitis among pregnant women, the offer of treatment and prophylaxis for infected women also, it's something that we need to continue and to promote to countries. And my final comments regarding the partnerships. We need to show that countries are not alone on this endeavor to eliminate hepatitis. Also the stakeholders, and especially the civil society and the community, they need to know that they are not alone, and we need to coordinate all the efforts among the different stakeholders. This meeting today is an example of how to put stakeholders in the same room together and to coordinate here at the global level and how to generate impact at the global level. But we need to replicate these examples at the country level. We need to put the community with the ministers of health and national stakeholders so they can coordinate and discuss how to make impact at the country and the local level. Thank you.
I'll call Meg forward. Meg, if you had some other comments from a WHO perspective, you can add it to those of our regional colleagues.
Thank you. I really don't have much to add because I had some slides on this in the very first presentation, but it's really about the fact that we need to monitor, we need to follow, we need to provide the technical assistance. And from WHO's perspective, it has been always a area of combined effort between Gavi and WHO on the IVB or the vaccine group to be working on how one could bring out forward new vaccines and introduce them into countries. So we're very much looking forward to seeing how we can work in partnership, but also from WHO as well as the IVB combination to see how we can do that together. The last piece I would say is the triple elimination framework. We've been discussing it for a long time. I think now you can go to the WHO website and really see what is the framework, what are some of the operational aspects that one needs to think about when we start to think about triple elimination, of which delivering on the Hep B birth dose vaccine is going to be a critical element. So all I have to say is I'm really glad that the regional folks are here to be able to tell you what's happening, because that's where the work happens, in the regions and in the countries. Thanks.
I asked Danjuma to come forward and see if you have any other thoughts. I'll give you an opportunity to express those. I also wanted to see if is Rabin Pasha here? he was, I had heard he was from IMRO and might be coming, so apparently not. So thank you.
Okay, so happy to have me back on stage. I think we have an opportunity to have a generation of children, babies, a generation free from hepatitis. And that would only happen if we get these vaccines, if we get the babies vaccinated and we get the pregnant women attend antenatal. I come from, of course, a region in Africa where a greater percentage of these women, like Rania said, in Nigeria, they deliver outside the facilities, and it's a challenge for them. And then we have challenges with immunization programs that will tell you they cannot pull out the vaccines and put in the delivery room. So strong collaborations are very important to ensure that babies are born without hepatitis. And I remember, I think it's, I can't remember the speaker that said this, that it's really terrible that future generations would ask us questions, what we did with the missed opportunity of not preventing hepatitis. So people living hepatitis are also concerned about not transmitting the virus to their babies. Pregnant women or women that with hepatitis are concerned not to have their babies infected with hepatitis. So strong collaborations, especially at the community level, as Leandro rightly said. So it's different to have policies at the international level, but how it goes down in Chad, in Niger, in Burkina Faso, in those hard-to-reach communities is where we could achieve result of elimination. And I hope that, like Harvey said sometimes back in Cairo, that I hope within our generation we should be able to achieve the elimination. It might be difficult by 2030, but it's not impossible. Thank you.
You have an opportunity to raise your hand and ask any questions of WHO or some remarks from the importance of community engagement. Also see I have Busy Bright here from Nigeria that does a lot of work in hepatitis B elimination among children, and maybe you can borrow one of those microphones if you want to either ask a question or give some remarks. This is your shot.
Thank you, John. I stand on all the existing protocols. My name is Bisi Bright. I'd like to talk about the work we're doing in Nigeria. Danjuma he said a bit about what's happening in Nigeria, West Africa generally. We are the Women in Hepatitis Africa, the only women's organization actually advocating for viral hepatitis on behalf of the women gender in Africa. And we work across the disparities, population disparities from low income, low literacy to the high income women. And we actually run a women's wellness center for hepatitis in a very low income part of Lagos. It's the biggest riverine slum in Africa called Makoko. It houses about 500,000 people, very low income, low literacy. We've trained women hepatitis champions in that community, women who've never been to school, never been educated, but they are champions, and we've been able to impact the uptake of birth dose vaccination because the women who have been trained as champions ensure that other pregnant women around them visit the health system. Even though they give birth with the traditional birth attendants, like Danjuma said, they would go to the health system within 24 hours of having their babies because of the fact that they know they don't want their babies to have a bad liver. We usually describe to them what a bad liver is. They know that if they see it in the flea market, so they know. So they don't want their babies to have a bad liver, and so they go for the birth dose vaccination, and we've been able to impact the uptake of birth dose vaccination very remarkably, and we hope to continue to do more. We also screen every single pregnant woman for viral hepatitis, whether or not they are giving birth in a skilled birthing center. They do come in for their screening because they don't want their unborn babies to have a bad liver. And where they test positive, we link them to care. So we facilitate linkages to care. There's a lot of advocacy and awareness work going on. And we hope that we'll have partners so that we can scale this work. It is very impactful. We have quite a lot of data to support this. Thank you.
Thank you very much. Any other comments? I think both, please raise your hand if you have a question. I guess for both PAHO and WPRO, I think you have a regional commitment to triple elimination, or in your case, quadruple with the Chagas disease. How is that going to increase engagement in hepatitis B elimination? Do you think that's readily understood, how the importance of bringing both maternal screening and timely, routine hepatitis B birth dose vaccination together? Just get your thoughts.
Okay. Yeah. Indeed. So in our region, we do have that, and but that requires multi-unit collaboration, and our unit is focusing on the immunization part, so the birth dose or dose immunization part, and our colleagues in other unit, they are focusing on the testing, treatment in that part. But we do work together in some of those aspects. So as you probably know already, so we have two expert groups. One is the ERP, help us on the immunization, and another one called the STAC, that is more of helping on the elimination of mother-to-child transmission. Thank you.
Yes, I think it's similar also for the region. Since we've published the EMTCT Plus initiative, we promoted integrated approach, and countries, they have endorsing this, and the policy uptake and the organization at the country level on how to respond to the EMTCT. They are, it's been really good to see that they are integrating hepatitis as part of this process. Like, for example, we had between 2015, just one country were officially committed to the elimination of mother-to-child transmission of hepatitis B, and that jumped to 10 countries in 2020, officially with documents stating that commitment. So we believe that was as a result of the EMTCT Plus initiative. The policy uptake has been good. Countries are introducing the screening for pregnant women, the prophylaxis with tenofovir. Many countries, especially in the Caribbean, have introducing the birth dose now recently in the past 5 years as a universal approach. But we still don't know exactly the access, how it's going regarding access. We don't have the information, so as Meg was saying, we need to monitor these. Countries need also to adapt their information systems to be able to generate the information that showing us where we are, especially and how we are progressing towards the achievement of the targets. But the political commitment has been really interesting to see, and countries are engaged in this. And also the same would be for Chagas, but hepatitis, comparing to the two new additions, hepatitis B and Chagas, hepatitis kind of is quicker than Chagas in that political commitment, I would say.
Thank you very much. I think that's all we have time for, but I appreciate your thoughts. Thank you very much.